Hi, my name is Rhonda Jantz, and I'm going to present an overview about water and sanitation in Uganda. This is our agenda today. We're going to look at an introduction and then some strategies to make water and sanitation better. Then we're going to dig into health outcomes and sustainability, and finally conclude with some recommendations and further ideas. Uganda is known as the Pearl of Africa. You can see in the map that there's a lot of water in Uganda. The green and the blue show a lot of water in this country. Just that small northeast section is the only area that doesn't get quite as much water. It has actually 2 rainy seasons each year. The problem is that they struggle with their infrastructure. So they have water and sanitation deficiencies. The cost of creating and maintaining water infrastructure is very high, and Uganda has limited resources. Rural areas are particularly impacted as the financial means are even more given the limited and fewer residents in that area. Uganda has really started to prioritize infrastructure development, which has made a lot of strides. Without the proper systems in place, water can easily become contaminated with bacteria, parasites, heavy metals, pesticides. In addition to these water issues, they also have wastewater purification systems that aren't closed, which means when it rains, especially in the rainy season, the floods can wash the sewage away from the systems and then maybe into gardening beds or things like that, which exposes the residents to bacteria like E. coli. The open sewage also can introduce parasites. The runoff has also led to heavy metals in the area like lead and cadmium and chromium. Lead exposure has been linked to anemia, memory, and learning deficiencies in children, while cadmium and chromium is more of a long-term risk of cancer. So additionally, they also grow a lot of plants in Uganda, and the pesticides can run off in that rainy season, which also increases those risks for adverse health impacts. And because of this, it's important to come up with interventions to improve the water and sanitations that are available. International organizations have been working with the government of Uganda. I put a list up at the top that kind of shows you some of those different organizations. Also, private companies like Coca-Cola Africa have been working to reduce some of the water issues. This is a really important issue because in Uganda every day diarrhea kills 33 children, and that is largely due to the lack of clean water. So right here is a picture of a borehole in Uganda, and we're going to learn a little bit more about boreholes and wells now. Boreholes and wells are one of the interventions that the people of Uganda have undertaken to create safe water. So the boreholes are narrow, long holes that dig deep into the ground about 200 feet. And they are typically sustainable, which means that they cannot become contaminated because they are dug so deeply. So that is excellent. However, a lot of the area wells are just easier and quicker and less costly. And this is a picture of a refurbished well in Uganda, which gives you some ideas of what a well looks like versus a borehole in the previous slides. In the rural areas, many access and utilize either a single borehole or a single well, and then hope that that is free from contaminants. Once again, the wells tend to have more contaminants just because they're wider and more shallow, and so the contaminants can get in times of runoff and excess rain. Another development intervention that can be undertaken is a pipeline system, which is sort of like what we have in the US. And this helps increase ease of access to families. You can get your water in your home. The materials utilized are sometimes different in Uganda just because of costs and what they have on hand. They may use plastic in certain circumstances or different types of steel than what we use here. And thus sometimes that can cause their systems to break down a little bit quicker. But the pipelines are typically not equitable in that those who live in higher income level areas and more urban centers are going to be more likely to have those pipelines, and those not living in, the higher income or in the urban centers are less likely to have the pipelines. Another concern that has been a big deal is the water sanitation systems. And they are being undertaken more and more. They're in a lot of the urban areas, yet not in many of the rural areas. The sanitation system really prevents that water from becoming contaminated to spread waterborne diseases like cholera or anything that could cause a diarrheal disease. The diseases are really impactful to the elderly and children. Organizations and the government have both funded some of these sewage systems, toilets, things like that. In some rural areas, there are families that share toilets. And so some of that just is something to think about, and some don't have toilets at all. They are being introduced at a rapid pace in Uganda right now. So that has been exciting, but the sanitation systems are still a major priority just because the water maintenance is not being done maybe like it should be, just because the priority has been to get the systems in place. The management system for the country is called the Water Safety Plan, the WSP, and it seeks to provide all the tools required to maintain water and sanitation systems. Continuing investment must be provided to maintain these. And what happens at this point is there are free riders. And from an economic standpoint, that means people who like the free water but don't pay to have it maintained. There's just not the property rights system like there is in the US. And so without any real owner, there's no one that's going to step in and take responsibility for that in the same way that it is, in a country with more property rights. It's estimated that 35% of all rural water systems in Africa are not functional, which indicates that that safety plan that they're working on still has a long way to go. Because of those limitations, it's important to rely, on these regulations to bring them up. So education is also a concern that we should mention. We have children in the picture sharing water in Uganda. Education about safe hygiene practices and the importance of clean water is often the most beneficial intervention when public health is considered. Poor water conditions increase the likelihood of diarrheal conditions in all age groups. In Uganda, diarrhea kills 33 children per day. Behavioral changes can happen when the population is educated about the importance of good hygiene. One of the programs that they have in the schools is called WASH, and it's to help children to understand hygiene in water, washing your hands with soap and water, not using open defecation if possible. And they also go through menstrual hygiene. And so this program has been somewhat successful, but a follow-up study has recently showed that 42% of the trained staff that are, have learned the WASH hygiene standards, they aren't functionally using it. And so I think some of that, there are some traditional behaviors. There's also issues with some areas not having as much clean water access as others. One study found that Ugandan families indicated that they had a high awareness of the hygiene standards, yet they rarely followed them. And so at least they were honest in explaining that. But I think some of the stuff has been passed down through generations. Oh, this is fine. This is how we do it. And in other situations, we just haven't had enough time for some of those rules to kind of stick in their minds. So, unfortunately, we have to look at health outcomes as well. The goal of the interventions is to improve public health by preventing the outbreak of disease, reduce mortality rates, things like that. The interventions explained are really extensive and very expensive for a period of time. However, studies have shown an increase in satisfaction with the services that are available in the last 5 years. So that means more and more are becoming maintained. Our citizens are showing more interest in using the clean water and sanitation facilities. The Ugandan government has pledged to have clean drinking water and sanitation services for all by 2030. That's only 6 years away, but it's something to think about. Our slide mentions that disparities still exist. More than 140,000 Ugandan citizens died from diarrhea in 2022. So we still have a lot of issues with clean water. Historical research has found that affluent urban groups were introduced to clean water and sewage before other residents. And because of this, the rural and urban slum residents are disproportionately impacted by that because they have less investment capital. And so that process just comes along a little slower. This is a girl collecting water in Uganda to kind of give you an idea of different places where they collect the water. I don't know if you can see in the picture, but there's a clear plastic bottle down at the bottom that you could take a look at to see how they do that. One additional study found several factors related to access to sanitation in impoverished areas, including the cost of sanitation facilities and the number of people who have to share a facility. Sadly, the poverty and unclean water cycle disproportionately impacts women. They are traditionally charged with hauling water to the family's residence. The distance between the water and the home really does impact how often they go to see clean water versus water near their home. And this is mainly because women have many roles within the household and lack the time to haul the water back. In addition, many businesses are also struggling, which is something to consider because we think about it as a rural area. Hospitals in many areas face challenges regarding clean water, sanitation system, and supplies. One study found a hospital that only had soap and water in 24% of the healthcare facilities that they studied. So it didn't say specifically where, if that was rural or urban, but if only 24% have soap and water in a hospital, that's concerning. If facilities are going to be trusted to care for residents, the hospital system must have these sustainable practices and resources available. At present, the sanitation services have not kept pace with the clean water. So sanitation's behind. Because of this, current wastewater infrastructure provides opportunities for residents to be infected with bacteria and parasites. Research shown that even if they all have clean water until they get clean wastewater infrastructure to where they're not going to have that water impacted by wastewater runoff, they're not going to lead to sustainability. So the function of that wastewater coming online needs to be a priority. Also, maintenance of current systems need to be considered because if many of the systems are not currently operating, that kind of takes systems backwards. Aid for that maintenance is needed. I think a lot of times people are willing to donate to new water, but maybe less willing to donate to maintenance just because that's not a shiny, that's not I did this water. It's not, you don't tell the story in the same way, I guess, with doing that. So what happens is Uganda must become somewhat self-supporting and they must learn how to figure out some aid for maintenance until that time can come up forward. Recommendations that I had, they should continue to focus on building pipelines, boreholes, and wells. And once again, like I said before, really dig into the maintenance aspect and that sanitation system aspect. Sometimes that maintenance is just as simple as testing water and treating it whenever challenges are found. Some of the issues are that some of the maintenance is being carried out by those who are not trained personnel. And so the government should focus on getting trained personnel into each of those areas. And then the new systems that they are putting in with the pipelines, boreholes, and wells should really be focused in urban, slum, and rural areas. So in conclusion, the interventions discussed have shown dramatic improvements. To showcase the current progress, the WHO found that life expectancy in Uganda has increased from 48.8 years in 2000 to 66 years in 2021. However, equity in access it is not realized at this time. It is being complicated by income and urban versus rural differences. The country of Uganda can make a lot of strides in improving access to clean water and sanitation by focusing on these impacted population groups. At present, the work continues with hopeful anticipation that the entire Ugandan community will soon gain access to clean water and sanitation systems. And then these are my references. Thank you so much for listening to my presentation today. Have a good day.